It brings the private sector, it brings the volunteer organizations, it brings local governments and state government representatives together.
The summit and the post-summit activities are a way to turn around and connect with other organizations and other professionals.
And I think what Meta Leadership provides to our professionals that work in those areas is what has worked across the country and what's worked across the world.
Meta Leadership addresses seeing a larger perspective of how disaster hits and the response to it.
I think this post-summit meeting will keep Meta Leadership moving forward in North Carolina because it will continue to bring partners together around activities to respond in the event of a natural disaster or other public health emergency.
Those same leaders have a vested interest in really affecting some change, and they look at this post-summit meeting as a start, as a jumping off point to bringing together these non-traditional partners, these multiple sectors, to start working together on how they can make some change.
We really formed a lot of cross-sector collaboration in order to proactively build those networks.
And I think the cross-sector resources are everybody being a part of the planning for the potential disaster and knowing that they've got resources that they can bring to bear on the disaster, whatever the case may be.
BB&T, I believe, as part of the financial sector, could provide cash availability during a disaster, which we've done in the past.
Mobile bank and mobile ATM services to get the cash flow back to the communities in the event of a mass power outage or mass damage to your infrastructure.
Novant could provide decon teams, hospital personnel, doctors, medical assistants.
Good opportunities to work with the Psychological Association, Social Work Association of North Carolina to see if we could get some volunteers to establish some readiness for post-traumatic counseling.
Getting into the schools and kind of getting that communication with the schools. So some of the resources they had were expertise, they had nurses, personnel, staff, perhaps some of the immunizations, and what we were really trying to look at is how to get into the schools, make those connections.
One of the things that we looked at in terms of communication is establishing MOUs, which is a memorandum of understandings with various other businesses around. One of the things that we have to take stock of is what we have in terms of assets and then what are those things that we're lacking. And going out to looking at those various other resources has been proved very valuable to us on several fronts. One is understanding what other resources are, but also looking at our staff and understanding, well, how can we integrate those external resources with the internal resources we got?
We can also provide fundraising opportunities, set up funds for disaster victims, and provide the distribution of that among qualified 501c3 nonprofits.
So we provided resources in terms of food, shelves, we provided locker assistance and any other type of assistance like security assistance, medical assistance, and those sort of things.
I think the H1N1 was a great example where we brought business partners together, community partners together, government partners together, and hospital partners together. And we all worked together to try to get North Carolinians prepared and they were ready to be vaccinated as groups. So I think that's one activity that Meta Leadership could really continue to serve a role in.
It's a matter of helping continue and expand our role in promoting preparedness.
What it's helped me to see is that there really is a place for nonprofit and business and government to stand together early on and say what resources we have and how we can provide those to one another.
They have a whole stack of resources that were written down that are going to be vetted by the state emergency management, which means that they're going to call back each individual who made a commitment and make a decision, yes or no, if this is going to be a viable resource for their emergency operation planning. That's huge.